and welcome. My name is Kerry Doman. I am the founder and CEO of LittleGuide Detroit, and today we are hosting our adulting series because one day you just wake up and you're an adult and you're a parent at that, and you're like, how did this happen? And how am I supposed to know how to do all of these things?
Mm.
One of which, and the biggest thing in my world, is insurance. As a self-employed entrepreneur myself, and my husband, also a self-employed entrepreneur, we have to get our own insurance, and that takes a lot of navigating. And so I personally rely heavily on the experts at Priority Health, and I'm so grateful for them. Miranda and Omira take care of me personally and my family, and so we have invited them here today from Priority Health to help us all take care of our families and answer these questions that we deal with all year round, but especially this time of year. And we'll get into why this time of year is so important. But first and foremost, I would love to introduce them. Miranda Potts, I'll let you introduce yourself first, and then we'll get to Omira.
Alrighty, yeah, thanks for having us again, Carrie. My name's Miranda Potts. I've been with Priority Health for about 9 years now, and I'm on the individual sales team. And I feel like we're just family at this point. I've seen you 3 times now this year,
Yeah.
so just keeps growing that relationship. And so we love working with you, Carrie. Thanks for having us again.
I know. And big shout out to Priority Health. Priority Health was our presenting sponsor of Stroller Roll. So if you met us out there, you know how influential they were out in making those events so amazing. I mean, your setup, but also the distribution of free diapers and wipes at both of our events, so key and clutch to making those events amazing. So thank you again to Priority Health for not only being our in-home. Literally, you're part of my home and our insurance every day, but being out there in the community with us as well. So thank you.
Absolutely.
And
Hi, good
Omira,
morning. Yes, hi, good morning, Carrie.
good morning.
So my name is Omira Mejias. I've been with Priority Health also 9 years, and I'm excited. I love this. I love that we're able to come together and have these conversations.
Yeah. So tell us a little bit about Priority Health.
Yeah, so I can start with that one. Party Health is a Michigan-based nonprofit health plan that's been nationally recognized for our quality and service. We are headquartered locally right here in West Michigan, but you may be familiar with some of the major hospitals in our network across Michigan, like Corewell Health East, formerly known as Beaumont, Trinity Health, Henry Ford, and the University of Michigan, amongst others. From the multiple free outdoor fitness courts that we've sponsored across the state to our involvement with local charities, like Little Guide Stroller Road event that we've done a couple of this year. We take pride in being a community-focused organization.
Yeah, and did you just open one? Okay, now I'm gonna go off memory, so correct me if I'm wrong. Is it in
Yeah.
Redford? Or where did you just open
Um,
one in Metro Detroit? Carrie can jump in if she can. But
yeah,
yeah, they're all over Metro Detroit, your fitness centers, outdoors, they're
there's several of
free.
them.
So yeah, especially in our area in Southeast Michigan, you've done a really great job with those. And so keep your eyes open because you'll see them throughout parks and walkways and really just great additions to the community as well. So yeah, just big shout out there as well. But yeah, let's get into it. We're here to talk about health insurance. And I mentioned before, obviously I have a family plan, but it falls into the individual health plan. Can you talk a little bit about the individual health plans that you offer and who it is for?
Certainly. So, an individual health plan is for anyone under the age of 65 who doesn't have healthcare coverage. So, if through like an employer, Medicaid, or Medicare. So, if you are like a freelancer, entrepreneur, early retiree, or between jobs, this plan is a great option for you. It can be helpful for families seeking flexible, affordable care options. And you'll sometimes hear individual health plans referred to as private insurance. They essentially
Mhm.
mean the same thing.
Okay, good to know. See, it's all these terms that it throws us off. I'm like, wait, I know what this is, but what's this? So this is why we're doing this, and we appreciate all of the terminology and help. Um, but I mentioned earlier that this is an important part of time or important period of time, and that's because open enrollment is coming up. Can you talk a little bit about
Yeah.
open enrollment, what that means, the timeline, etc.?
Absolutely. Yep. We are gearing up for open enrollment, which begins November 1st. So, the open enrollment period, often referred to as OEP, so we'll get into some acronyms here. OEP for open enrollment, it does run every year, November 1st through January 15th. During this time, you're able to enroll in a health plan through the federal health insurance marketplace or through a private insurer like Priority Health. There's two halves, so let's talk about that a little bit. The first half of open enrollment ends on December 15th, and that is for coverage to begin January 1st. January 15th is the final deadline to enroll in coverage for 2026. Any enrollments done between December 16 and January 15 have a February 1st effective date. So important dates to keep in mind. Carrie, write that down. And
She's calling me
um,
out. Tell you why she's calling me out because January 15th is the deadline. And about I'll give myself some credit. About January 13th, I'm usually pinging Miranda. Miranda, we need to review my plan for 2026. So
Yes.
yes, I will put it in my calendar and try to be a little bit earlier on this, but it is important, and I always know I have the coverage. So to me,
Yeah.
I can push it because I know I have the coverage until I already have my existing coverage that
Yes.
you can
Roll
help
over.
switch over. It will roll over and then it will automatically switch if it's the February
Mhm.
1st deadline. If you don't have
Correct.
that, December 15th is your deadline, right? So you, as you
Yeah.
said, you have to know the dates. You have to know what you have and what you don't have. And so that's why I tend to push it. But I will it's in my calendar. I'm putting it in now.
Good.
But let's talk about like if you hit after January 15th at January 16th, are you cut
Yeah.
off? Like, is that what happens after that?
Yeah, no, so we have a great team, our Michigan-based enrollment specialists. They're incredible at walking prospective members through this whole process of open enrollment and even after enrollment is done. So you're not out of luck, not necessarily if you miss that date. You may be able to qualify for what's called a special enrollment period, or an SEP, as we refer to it as a special enrollment period. It's available year round to people who have gone through a qualifying life event. The most common qualifying life event is the loss of, say, your existing health coverage, could be with an employer, or you're aging off of your parents' plan, you're losing Medicare, Medicaid. All of those would give you a special enrollment period. But also,
And
maybe you're
I'll
expecting
insert
the birth.
also, sorry to
Yeah,
interrupt, but I'll insert also
but
that with this demographic, another major life event is having a baby. So
yes.
that qualifies, and that's with speaking to our
Hmm.
audience here of parents and
Yeah.
if you're growing your family, that's a big one that I've personally dealt with throughout the year within the year to have to adjust.
Absolutely. And there's some important time frame that you need to be aware of with that, with special enrollments. So again, like Carrie mentioned, if you're expecting the birth of a child, if you're adopting a child, or you could actually be moving to a different coverage area, that could all potentially qualify you for a special enrollment period. Um, but again, the time frame is 60 days. It gives you 60 days before or 60 days after that event to be able to enroll in health coverage. So timeframes are really important.
That I didn't know that. So if you are pregnant, you should
Yes,
be planning out a couple months ahead to get that coverage time, not
absolutely. I
the time of the
remember.
birth.
Yes, I remember
Okay.
when I was getting ready to have my son, I made sure it was on my list of things to do while at the hospital,
Hmm.
after I birthed him the next morning to wake up and call my insurance carrier at the time to get Elijah added at that time. Because yes, you have a 60-day window, but you get it out of the way. Otherwise, with a new baby, you get home, you're exhausted, things, you forget.
Yeah, yeah, for sure.
Yeah.
And I think it's worth mentioning that just life is expensive. Things are expensive,
Mhm.
and um, and coverage is as we go through it. Is there ever a scenario where it doesn't make sense to have coverage?
So that is an important question, and we may be a little bit biased here at Priority Health, but honestly, going without insurance coverage is a little bit risky. Without health coverage, a single hospital stay, for instance, can cost up to 3,500 per day. An
Oh,
ambulance ride over 1,000. So even
oh,
routine appointments like preventative care exams, annual checkups, which play a crucial role in your long-term health are covered with a My Priority Health plan. Now, it can cost you hundreds of dollars out of pocket if you don't have the coverage. So having that extra coverage is kind of a big deal. It gives you a peace of mind knowing that you and your family have access to necessary medical services, and you are free from the worry of illness or accidents leading to overwhelming expenses. And you don't have to shoulder that alone. As the old saying goes, it's better to be looking for it than or to be looking at it than be looking for it.
yeah. It's it's a lot. And I know, we're all feeling the pinch of everything and
Mhm,
is
absolutely.
so obviously, you talk about some of those numbers, it makes a lot more sense to have it. And I have three kids, and we had a broken arm this year. We had a chipped tooth, all of these things that you can't plan for. You don't know what's coming. But in saying that, is there a way to save on health insurance?
Yeah, and I was hoping that we'd talk about this because you're right, especially with kids. I had an ER visit too this year, so with my son. So yes, things do get
Sorry.
expensive. So yeah. So yes, there's several ways that shoppers can save on their health coverage. First, they can see if they're eligible for a subsidy, also known as an advanced premium tax credit. I can throw the acronym in there, APTC. Some people may call it as well. If they are not eligible, however, for that subsidy, they can still save money and reduce the cost by buying directly through Priority Health for an off marketplace plan and choosing a plan that best fits their needs. We do offer off marketplace plan options on all of our tier metal levels and can find the right plan for you, whether you're looking for the lowest cost premium, HSA options, or even plans designed to travel with you. And again, we do have Priority Health Enrollment Specialists that will help explain all of this to you.
Yeah. And I get all of that, and I know the definition of a subsidy, but can you describe what it is and how they work?
Of course. So a subsidy is a financial help offered to you by the federal government, and it helps lower the cost of your health plan and reduces potential out-of-pocket cost. It's through the Affordable Care Act, or known as the ACA. So there's two main types of subsidies. There's the the advance premium tax credit and the cost share reductions. So with the premium tax credit, it's a financial help from the government that helps you effectively lower your monthly premium costs. So a family of four can have an income of 124,800 and they can still qualify. The second type of subsidy is the cost share reduction, or also known as CSR. It's an additional benefit that you can qualify for via the marketplace that does apply to our My Priority Health or Priority Health My Priority Silver plans.
Now we're getting into another definition. We're just going to keep taking what you say and peeling back the layer of the onion. Okay, so tell me about the silver plan. And I know there's bronze and gold and silver.
Yeah.
What is the silver plan, and what's the difference between the different metals, if you will?
Yeah, we'll get you a definitions page here
Please.
to follow
All the
this.
acronyms.
So, yeah, so great segue. So, when you're shopping for health coverage through the health insurance marketplace, you'll come across terms like bronze, silver, and gold. Don't worry, it's not an indicator of the quality of the plan or coverage. Because if it was, I guess all of our plans would be platinum then at that point, because they do all have great
Thanks.
quality and value. So, It is simple because the Affordable Care Act classifies health plans into metal levels or tiers, if you will.
Okay.
These tiers represent different health plan options, which are tailored to fit different budgets and coverage needs. So Priority Health offers plans within each of those three metal tiers. And specifically, you asked about the silver plans, though, so let me touch on that a little bit. We do have the My Priority Premier Silver plan, which is ideal for those seeking a balance between coverage and cost. It's one of our most popular plans, so it's something that I talk about a lot, and it offers a lot of coverage ahead of deductibles. So the silver tiered plans are great options. They do provide comprehensive benefits and may qualify you also for a cost share reduction, which Elmira had touched on. These plans, they're particularly beneficial for managing chronic conditions, offering affordable deductibles and copays for those specialist visits, lab works, and even if you're taking brand name or specialty medications, the silver
Mm.
plans is the way to go.
What qualifies as a chronic condition then?
So chronic conditions are elements that persist for more than a year and they do require ongoing medical care, such as like asthma, diabetes, high blood pressure, heart disease, depression, liver disease. These are all considered chronic conditions. Now, a recent study did find that excuse me, that 60% of Americans live with at least one chronic health condition. So Priority Health is committed to reducing that percentage. It's why all Priority Health members get a $0 preventative health care and they have access to medical services, supplies, and medications for many chronic conditions for just the cost of a copay or coinsurance. And that's before you even have to meet your annual deductible.
Okay. Uh, I'd love to switch gears a little bit. We're taking a trip. Well, I mean, we're taking a trip within US, but then we're also traveling abroad in 2026. And what what happens? I always think about this. Thankfully, knock on wood, we've been fine on the road, but what happens when you are on the road or abroad even with your health coverage and seeking medical attention and needs?
No, that's a great question. So in general, all of our My Priority plans do offer coverage for urgent care and emergency room visits when you're traveling outside of the service area. So outside of Michigan and abroad, again, on all of our plans. However, want to specifically talk about our travel plan options that we offer. These plans are great for traveling nurses, over-the-road truck drivers, snowbirds, that kind of thing. There's tons of families right now just traveling across the United States in their cute little vans and stuff. So this is going to be a perfect plan for that. So let me jump into that a little bit.
Yeah.
Because again, so whether it's for work or just for fun, that's the last thing you want to worry about, right? While you're traveling is your health coverage. So it's why we offer the My Priority Travel Plan. It lets you receive services and care at the in-network prices from participating Cigna Open Access Plus providers. I know that was a lot. So, Cigna Open Access Plus providers outside of Michigan and within the United States. You also get access to 24/7 zero cost virtual care, which is and can be a lifesaver. So you're not having to hunt down, that urgent care
Mhm.
center emergency room, if it's something, you can deal with virtually. Plus, every My Priority travel plan comes with a Priority Health Travel Pass. All you have to do is show your member ID card to a Cigna OAP provider.
And on the topic of traveling, another thing worth mentioning is our member access to Assist America. Now, the way that Assist America works is like if you or someone on your plan falls sick or gets injured, Assist America provides emergency travel assistance services when traveling to a foreign country or more than 100 miles from your home for up to 90 consecutive days. It is included in most priority health plans and covers the cost of all travel services related to getting quality emergency medical care, medical referrals, critical care monitoring, and emergency evacuation and other support measures. Now, Assist America can provide pre-trip assistance to help you find a doctor or pharmacy or even to fill your prescriptions at the destination that you're at.
And so I heard you just say it's included, but Miranda, the part that you were talking about is that included or is that an add-on?
So the Assist America, that is something that all of our members have access to,
Mhm.
whether you're on a travel plan specifically or not. We like to call that one of our value-added benefits.
Okay.
And we
Good to
touch
know.
base
And
on
no
those a
additional
little bit.
cost. Hmm.
Yeah.
Yeah. Perfect. Okay, switching gears again, we're going back to the acronyms. I'm always confused. Miranda can laugh again because the first time we talked, I was like, I have this. And she's like, well, do you need that? I was like, I don't even know what this is. HMO, HSA, like, I don't know what these mean. So talk to us a little bit about, let's start with HSA. What does that mean, stand for? What are the benefits or what's an
Yeah,
HSA?
absolutely. Yeah, so an HSA is a health savings account. So when you're covered by an eligible high deductible health plan, you can use an HSA to pay for your healthcare costs. Best of all, and I think the most important part to some people is that it's tax-free dollars. So it's just like a regular savings account or an IRA. Some people who I speak with, it's their investment in their health for the future, and so they're constantly saving in there. Your health savings account is your money, meaning it will automatically roll over year after year. It's not a use it or lose it. The HSA funds, they come out. You can deposit them into this savings account. We do partner with Health Equity for that, and I can let Elmira speak a little bit to that.
Yeah, so Priority Health offers both HSA and HSA travel plans. We even have specific plans designed for families who want to lower the deductible plan, but still want the tax advantage of a health savings account. So Priority Health has teamed up with Health Equity, which I love. I've been using for the last 9 years now. And it's super easy. They have the app, so it's a free savings account for members to enroll who have a My Priority HSA plan.
Okay. We'll keep working on that for me. And to understand, because it's hard. It's you hear this and you hear the definition, and then it's hard to know like, is that something that's a value or benefit? But I guess again, and I said it at the start, and I'll continue to say it. That's the beauty of having you guys, the experts, a phone call
Yeah.
away, and to really look at each individual scenario and plan and what is best for your family. Again, Miranda, that was your question. Did
Mhm.
I had the HSA, and you're like, are you using it? I was like, no, I don't even know. So, you know, it's it's hard. It's hard. I didn't even know what it was,
Yeah.
and I had it, but we weren't utilizing it. So your next question was, well, are you going to utilize it? I'm like, no, I don't know. It's like unless I understand. So again, it's I am here to bring the real talk, um, and
Absolutely.
kind of bring it down to the level of like, okay, this is what we're really dealing with and trying to
Mhm.
comprehend what you guys are saying. You're a wealth of knowledge, but sometimes it just takes a personal phone call to you guys to say, okay, this is my situation, this is my family, this is what works, and then you guys help with those. Like what
Yeah,
works best.
what works for one person might not work for another person.
Yeah,
So like you said, that's exactly why we're here is to filter that for you, I guess, essentially. Yeah.
100%. And I'm here for it every single year. That's why that's why we're family. Um, Okay, earlier you were talking about in-network, narrow networks, out of network. Can you talk a little bit about that narrow network concept and what that means, how that applies to each plan?
Absolutely. A narrow network is a group of doctors, hospitals, labs, outpatient facilities focused on providing care for their community at a
Mhm.
lower cost. It's a great, affordable option for individuals and families who live near a narrow network hospital system. Members with a narrow network plan, they get all of the benefits of our traditional coverage plans with the cost saving advantage of a lower monthly premium. Plus, you're getting local community focused care as well.
Yeah.
You do not need a referral to see an in-network specialist as long as they are participating with the narrow network that you have enrolled in. They are considered in-network, and you have access to all in-network pharmacies too.
Yeah.
Uh, Currently, the My Priority, we offer four narrow networks on the east side of the state. We have Southeast Michigan Network, which consists of Coral Health East, formerly known as Beaumont, and Trinity Health East. So those two hospital systems are underneath that umbrella for Southeast Michigan narrow network plan that we offer. And we do also have Trinity Health East as its own narrow network as well on the east side. It is worth noting, though, that if you have a My Priority Health Narrow Network plan and seek care outside of your network, you'll be responsible for any out-of-pocket costs with that.
Mhm.
Got it. Yeah. I think one of the greatest things about my priority health coverage is no, I just lost the names of it, where you don't need a
A
referral.
referral.
Hello.
Referral, yeah.
Welcome to the
That
Yes,
makes a
yeah.
conversation.
big difference.
See, I'm
It
like,
does. Yeah.
guys, this is the real. The referral piece, because what I had before
Yeah.
years ago when I had a different way, like you need a referral and that takes time,
Mhm.
and then they have to get it over to and you're like, I need to see someone, right? And I think that was
Yeah.
when we first talked years ago, I was like, you had me at no referral. That
Yeah, and I
is
think that's
so beautiful.
Yeah, I think that's a misconception too, is that Priority Health, we do not require referrals when you're seeing a specialist. As long as they're in network with your My Priority plan, you can choose whichever specialist you would like. You don't have to get a referral. There is an exception to that with the University of Michigan. We can touch base on that a little bit later. I don't want to get too off track, but yes, that is something that has definitely changed with the times. So,
And
Yeah,
there are some instances too where, you may want to self-refer. So just for a little bit of education, there are providers that do require a referral. It's not something that, again, Priority Health requires, but it may be a requirement from that office. So just
sure,
kind of wanted to make sure that,
correct.
they understand that, to know that, you can self-refer, but sometimes the referral is needed just for the office. That's one of their requirements.
sure. But some
Hmm.
other plans, you have to have a referral
You
for
have
every
to,
single
right.
thing. And it
Hmm.
is so, again, when we
Yeah.
have five people in a family and you're just like,
Mm,
it's just another step and it's a time consuming step. So
Yeah.
yes,
And
there's always
costly.
loopholes. And, you mentioned
Hmm.
the University of
yeah.
Michigan. It's like, again, once again, when I call Miranda, we go through like this is where we generally go and I live in this area and this would cover it or this wouldn't cover it, and you have to know you and your family and what will work best. And so um okay, benefits, we've talked about the main benefits, but I know you guys offer extra and amazing benefits. Can you talk to us a little bit about those?
Yes. So when you enroll in a My Priority plan, you get coverage that supports your family's physical, mental, and financial health, like $0 preventative services. It's coverage that helps you find the right balance between saving money and staying healthy. With benefits like on-demand mental health support, virtual visits, including a $0 virtual urgent care option, which I myself used a lot. I
What's
rather
that?
do that. What's that?
What was that? A zero
Oh, so
dollar
the virtual urgent care options. Yeah,
Yeah.
so you can do that from the comfort of your own home. So for instance,
Mhm.
my son got pink eye and I didn't feel like, getting ready, having to go to the urgent care just for
Right.
to sit there and do all of that. I was able to schedule that appointment right from my phone, and they assessed him. They were able to send the prescription over to my, closest pharmacy that I prefer, and I was able to pick that up without having to, go through the process of going to the urgent care, then going to the pharmacy. So it is a really, really great um tool that Priority Health offers to our member. And another great extra that Priority Health members do get is that easy access to care. So the easy access to use the Priority Health member portal and our Find a Doctor tool, it ensures that your providers are where you are and where the need is and in network, most importantly.
Yeah. I
Yeah, we do. Oh, go ahead, Carrie.
I was gonna say I use that portal, Find a Doctor, and especially in going back to, I mean, I've been with Priority Health for years, but when we first did it, that's the important thing. You know, Miranda and I used that tool to look
Mm-hmm.
up my OB and my pediatrician. Everyone and my I had to find a new physician, which is great. I love her now. I'm glad I switched because I love
Oh,
her.
good.
But I really wanted, I was still in the years of having babies, so the OB was important
Mm,
and my pediatrician. I really loved my pediatrician, and my kids were comfortable going to her. So that was the tool we used to make sure that, hey, these two are the important ones for me. Are they in network? Is this going, or do I need to, and then we realized my physician was not, but I was like, you know what, that's the one. I can find a new one. And then she helped me find one that was in service and in network using that tool. So it was very easy, and like I said, I like her better than my last one. So it
Good.
worked out really well. But you have those doctors that you want to keep, or you want to, try to make
Mm-hmm.
sure that they are in network and know before you switch. That's
yeah.
my little real PSA.
Yeah, real life examples, which are always helpful, right?
Yeah.
We do also offer a variety of ways to help our members keep costs down, and I think that's important right now. So, like low prescription copays, our cost estimator tool we offer. So, if you have a procedure coming up, say a knee replacement. You can use the cost estimator tool to find how much that is going to cost you with your current plan. You can look for lower cost facilities in your area to utilize as well. So that is a wonderful tool. We have discounted hearing aids and exams. We also offer access to Price My Meds. And speaking of going back to traveling, we include a global emergency assistance program. And there's a number of ways outside of that that we help our members to stay fit, which is our Active and Fit program with the gym membership. We already talked about the fitness centers. So we have those to utilize as well. And there's gosh, over 10, oh, Myra, correct me if I'm wrong, over 10,000 gyms that participate with the Active and Fit
Mm-hmm.
program.
Yeah.
So
And
I don't
growing.
think you're going to have an issue finding that. Yeah.
Mm-hmm.
I love that. Uh, and in that realm, I know that you guys do a lot with moms, and obviously as a mom of three, but as a community that we're surrounded with a lot of moms. Can you talk a little bit about
Mhm.
Priority Mom, Priority Baby? I think these are such special programs that you guys specifically do, and really speaks to our audience.
Yeah, it's a reason I'm proud to work here and to be a part of an organization that is family first and family focused here at Priority Health. These are two relatively new programs, the Priority Mom and Priority Baby. Priority Mom is a maternity program aimed at supporting soon-to-be mothers throughout their pregnancy journey.
Oh,
We provide educational materials, helpful resources, and thoughtful gifts. It aims to promote healthier pregnancies and reduces the total cost of maternity care for expectant mothers. Uh, Quick little fun fact for you. The mom in Priority Mom is actually another acronym, right? So it
oh.
stands for Maternity Offering for Members. Had to throw it in there, right?
Oh my God.
Um, and another special program is the Priority Baby. That is a newer one. It's been going fantastically. People are enjoying that. It's another family first program. It's available to members with newly added newborn dependents. It's designed to support parents, caregivers, even and their babies up to the child's second birthday. So not just that first year, going into that second birthday, the terrible twos, by providing resources and answering common questions about infant health and safety. Once members opt into Priority Baby, they'll receive that welcome gift and ongoing communication with education pieces and other resources to help them.
Love that. All right, let's start wrapping this up in terms of the nuts and bolts. What do we need to know? I know we talked a little bit about the dates, but let's talk about of open enrollment.
Yeah.
How does open enrollment work? Enrollment in general work? Um, yeah, how do we get the ball rolling? Because sometimes that's the hardest part. Just like
Yeah.
I know I need to do this, and that's also why sometimes it's January 13th and I'm calling. It's on the list, but how do we help people get the ball rolling and make this phone call to make it a lot easier to get going?
Yeah, well, it's actually really easy. If you have 15 minutes to spare, I promise we won't hold you hostage. That's all it takes to get the enrollment process rolling. So
It's
there's a
actually the
couple.
opposite. I'm holding you hostage. I'm like,
Yeah.
yes. Miranda, are you sure this is like, take a look at this? I like give it all to you guys. I'm like, just make
Uh-huh.
sure I'm covered. Make sure,
Right.
because the worst thing is like, if you're the layman and you don't know this stuff,
Yeah.
you think you're doing right by your family. You think you have the right
Mhm.
coverage. And that's why I'm the biggest advocate for calling you guys because I don't know. I don't know, it's like I'd rather just tell you everything I need and you tell me
Yep.
what fits best for me, right? It's
And
like,
honestly, we
why?
really appreciate that. Sorry
Yeah,
not to cut you off, but we
Yeah.
do.
no,
The more
it's,
questions you ask, the more that we know and the better that we are able to serve you. So
yeah.
we ask away. That's
That's
what we're here
so
to
I'm
do.
flipping that script and that
Hmm.
I hold them hostage of like, here it is, cover me and make it the best. So, anyway, sorry to
Yep.
interrupt, but
No,
yes,
you're
go.
good. If you have that 15 minutes to spare, that is all that it takes to get the enrollment process rolling. So there's a couple of ways to apply for health coverage with Priority Health. You can call us directly and speak with a enrollment specialist. That number is 833-630-1115, and we'll walk you through every step of the process and help you and your family get the right plan at the right price point. You can also apply on your own online by going to mypriority.com. Either way, it's straightforward and it doesn't take long. Unless you got 1,000 questions, and we'll be more than happy to answer them. So,
It is
And that is
straightforward
okay.
online. It is very
yeah.
straightforward online. I've looked at, but I just like the comfort. You guys do a great job. And that's genuinely like that is why we are so close because
Mm.
I genuinely appreciate the fact that I can just spew out. Here is what here are the ages this year, right? This is what we're dealing with. This is what I'm dealing with, and my husband. So it always makes me more comfortable to call, but you are right. It is easy online. I prefer the in person over the phone. My personal preference.
Yeah, and
But
building
That's
that relationship with
yeah,
the person who is enrolling you too. We're here through the year with any questions. We have an award-winning customer service team, so they are happy to help too. You can't ever stop with your questions. That's why we're the experts. You guys come to us, so always happy to help.
yeah, absolutely. I mean, I think I've said it enough of like so many different reasons and examples and real life examples of why I love Priority Health.
Mhm.
But tell us, I know you guys obviously, you said at one point, Miranda, it makes you proud to work there. Tell us a little bit about, I mean, why you love working there, why Priority Health, why people should call you guys.
Yeah, great question. So honestly, the advantages of Priority Health are really numerous. Take customer service, for example. For the second year in a row, Priority Health has been awarded the America's Best Customer Service in 2025 by Newsweek. And
Oh, that's
that's no small
awesome.
feet. Yeah, thanks.
Yeah, that's
And that
amazing. I
is,
believe
it
it. I
is.
believe it.
And me and Miranda both come from customer service. So
Yeah,
we've been in that role. So, and
yeah.
they do care. So, with customer service, well, sorry, and because of Priority Health, it's all about going above and beyond to make getting access to care that you need both easy and affordable. So we don't require referrals. Again, I just wanted to mention that again.
Love that.
for our members to see a specialist other than U of M of Ann Arbor. And with Priority Health, we have that member portal, and it gives you the access to those virtual care right from the comfort of your own home. So on-demand virtual care is also available for urgent care and mental health needs. So, Miranda, was there anything that you wanted to add?
Yeah, absolutely. I mean, it sums it up again. Party Health being in the community, it's just one of the reasons I like working here. I guess to add to that or to emphasize is, the community support and the commitment to putting people first. Love that about Party Health, and I love that about working here. Omira and I are out in the field a lot doing events and in the community with you, Carrie, over the past few years now. And it's a joy to see our members come up and say hi to us. So love doing that. It's just rewarding to be a part of an organization that's mission is to improve health, instill humanity, and inspire hope.
Love that. Well, I am forever grateful, and that's part of why we do this adulting video. I hope everyone was able
Mhm.
to gain some knowledge and a little bit of expertise. Every year, I'm getting better. I'm getting a little closer.
You are.
But I also know that I can rely on you guys, and I'm so grateful for that and the work that you do and the help that you provide not only myself but my family and our Little Guide community. So thank you again both for spending the time with us, walking us through each every step. Um, Again, I can't say enough. I am truly a partner, but I am you're my provider, I should say. I'm a user, if you will. I have Priority Health covering not only myself but my family, and that means a lot. That's a personal thing, and I can't say enough about you guys and the work that you do, and the work that your customer service does as well. So thank you again for your time. Thanks for your expertise. Thanks
Yeah.
for dumbing it down for us real ones. And once again, we'll put the number and we'll put the website below everything. And we encourage you guys to call Priority Health throughout open enrollment. One last shout out. When are the dates again?
So November 1st through January 1st, January 15th, there's two parts. November 1st through December 15th for that
Yeah.
January 1st effective date, and then December 16th through January 15th for February 1st effective dates. Very important dates.
Yes, yes. And it's on my calendar for January with Miranda and I.
Good.
So,
Good.
in saying that, thank you again, ladies. Have a wonderful day. We hope that everyone has a great experience with Priority Health, just like I do. So, thank you again.